Let's check back in now with Brooklyn Borough President Eric Adams, who joins us to talk about what folks there can be experiencing. First of all, thank you for being with us. We appreciate your time.
Thank you very much, Betty. Good to speak with you.
Absolutely. So give us any updates. Do you have any new numbers of positive coronavirus cases in Brooklyn?
No, we're still analyzing with the mayor and the governor sending over. The numbers have changed significantly since yesterday, and our staff is coming in and doing an analysis in a few minutes.
Significantly. So what does that tell you?
It states that this is going to be a very challenging time, as the mayor and the governors indicated in the beginning, that this is only the beginning as we continue to evolve, and this is going to take a few months for us to cycle out of it, and we have to all participate as much as possible to prevent the virus from spreading to our family members.
Yeah, we heard the governor say we're not flattening that curve as quickly as we had anticipated. You, in fact, though, have been hitting the streets on a regular basis this week. In fact, you've been distributing masks to folks in public housing projects. You've also been giving them to Flatbush Depot there, a bus depot, to those transit workers. What are you hearing from people on the streets?
Well, I think we need to keep in mind that we have to fight this virus on two fronts. One is in the hospital, where they're going to deal with the individuals who are currently experiencing illnesses now. The second is we have to stop the feeder. The feeder are those who can spread it among their family members, the firefighters, the police officers, the people in the grocery stores, those in NYCHA. When we think about those who are most susceptible to be seriously ill, they are asthma, pre-existing chronic conditions. Those are NYCHA residents. So we knocked on doors, gave out a mask to these individuals, because we want to stop the feeder as we fight on the front line and help our hospitals as well.
Let me ask you, were those N95 masks?
No, they were not. We're trying to get N95 masks for our hospitals. Our hospital needs the N95 masks.
Right.
We want to get those for the hospitals. But the everyday masks to stop those with the virus from coughing and spreading the virus is something we want to get to people on the ground. Now, I'm a little dismayed because we're hearing on one end of government that the hospitals have enough masks, but on the other end, my hospitals are calling me and saying we're running out of supplies. I have about 10 million masks ready to come to the city. I spoke to those with international relationships. I don't know what's taking so long to get these supplies to our hospitals. We need to get them to them and to get them to them in a rapid pace.
Absolutely, because they are on the front lines, and those masks can be the difference between them contracting COVID-19 and then being not able to help those who need the essentials from them at this time. What is the hospital capacity like at this moment?
Well, every day the governor gives a different level. Our ER, our emergency rooms, our ICUs, our hospital beds, we're dealing with serious crowdedness and overflow. And that is why we're building up the Javits Center to get more beds there. But I'm calling on the governor. Clearly, Queens and Brooklyn, that is the epic centers of this virus. In New York City, which is the epic center of the entire country. We need new hospital beds here in Brooklyn and Queens, which we have the largest cases in those two boroughs and the largest population. I believe that we have undercounted the numbers. We have really moved away from testing as much as we should. I think we should use testing more to isolate those who have the virus, and we should use the cruise terminal, which is a large location that we can build a hospital there as well. We need to do more focus in the outer borough. Manhattan has a lot of beds. We need to look at the outer boroughs.
Well, it's disheartening to hear that we're moving away from testing when you say the need is so important right now. Eric Adams, we are simply out of time. We do appreciate your time today, and of course, we'll be in close contact with you for any updates. Thank you.
Thank you. Hang in there, New York. We can get through this.
Absolutely. You stay safe. All right, coming up.